Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we have Dr. Erson Religioso with us. He is a physical therapist out of New York. He is someone that has been a mentor to me over the years, and so I'm excited to have him on this podcast. And we're going to talk about something that's going to be very interesting and applicable, leaving you with some practical tips. And so I'm excited to have him on the podcast. Thank you so much, Dr. E, for being on the Headache Doctor podcast.
Yeah, thanks for having me, Jono.
I want you to start with just a little bit of your background. You have a practice that where you treat jaw pain, headaches, and by the way, for the listener, that's Edge Rehab in Sports Science in Buffalo, New York. Is that correct?
That's right. Yeah. Everything around my brand is all E-based, whether it's Dr. E or the Edge Mobility System, which is my e-commerce store, and my clinic is Edge Rehab and Sport. I always said that I would never name anything after me, but I secretly kind of co-branded everything after me because even like Edge Rehab and Sport are really like ERS, like almost spelling out my name, you know?
Yeah, I love it. I
But it's
love it.
easier
So
to say Dr. E. You can call me Erson. It's easier to say Dr. E though, because as you know, I'm sure everyone kind of mispronounces my name. But yeah, I specialize in jaw pain, headaches, TMJ, but also just spinal pain, kind of athletic injuries, chronic pain, or just people who can't find help with your standard kind of either healthcare or from standard PT or chiropractic.
yeah, that's fantastic. Um, I and you also travel around the country teaching other physical therapists, and so you're an authority in the space of what you've branded. I think it's your branding of modern manual therapy. Is that correct?
Yeah, it is my branding, even though Chad Cook and Tim Flynn have recently taught courses called Modern Manual Therapy. So, but it is my branding. I've had the that as a not trademark brand, but I have a common law kind of brand mark because I've had it for so long that people can't really argue that is unique to them. But it's also I also brand under the eclectic approach, and that's always been my approach to kind of be eclectic and take whatever works from all the other various gurus and authorities in our profession and even outside our profession and kind of amalgamate it into one kind of unified approach that often simplifies the things. So even though a lot of approaches work well for whatever they purport to treat and assess, many of them have a bit too much minutia. So I kind of strip away the minutia and simplify everything to make it easier to digest and utilize.
Yeah. I think that's fantastic. Um, when it comes to the individual with headaches and migraines, uh, you're also in the headache space, jaw space. These are challenging cases, and so you've helped physical therapists all over the country, including myself, and then you also see people locally. A lot of our listeners here are looking for resources near them. And then you also have a coaching option. Is that geared more towards physical therapists, or is that also a patient option?
Well, yeah, I do mentor physical therapists online, whether it's like asynchronously or just
Yeah,
through my online courses, like I did with you, because I don't think I've ever formally mentored you, but a lot of people just get out a lot out of my videos and a lot of
right.
my online courses. But for sure, for patients, I do consultations in New York State. It would actually be physical therapy, but outside of New York State, I just call them consultations. And a lot of people reach out to me, but for sure, if something if you find that you have an issue that Dr. Taves can't help you with, or he refers you to me, or maybe it's outside his wheelhouse and it's anything outside of here to here, then I'd be happy to
Right.
also take a look at you because I do treat people say, "Hey, do you treat this?" And I'm like, "Look, if it's attached to your body, then I can probably help you with it." And it's not like I'm some kind of miracle worker, but on average, I see people over the course of 2 to 4 sessions. And that's because you're either going to get better or you're not going to get better. But if you're not getting better, I don't keep on beating that dead horse. There's
Right.
there's a good way to raise your visit average is to keep on seeing people who are not responding at all.
Yep. Yeah, that's fantastic. So, what I wanted to talk about specifically, I mean, we spoke last last week, and we got on this tangent of talking about overbreathing. And so
Hmm.
on this podcast, we have had several specialists in the airway space, breathing and airway. We've had orthodontists, dentists, other physical therapists in the myofunctional world, where they're all trying to improve how someone breathes and their swallow, looking at tongue mobility, all this stuff. And then, you started talking about overbreathing, which was a little bit of a new concept for me, but was fascinating. Can you tell us more about overbreathing? And I'll just tee it up where you said, when I have challenging patients, I oftentimes go into this overbreathing concept with them. So what does that mean?
Well, to back it up though, there would be three aspects of breathing that you should look at. And the majority of great physical therapists or ENTs or dentists or any people who are kind of practicing in this breathing space, they look at the mechanics of breathing.
Mm-hmm.
So the mechanics of breathing would be simply, do your lower ribs expand? Are you diaphragmatic breathing? Are you sternal breathing? Sternal or chest breathing has kind of been associated with headaches and neck pain and a lot of upper body tension. A lot of books that go over dysfunctional type breathing. They also would say it's associated with chronic low back pain. Um, so the mechanics of breathing are definitely very important. The second aspect would be the psychology of breathing. So breathing. Um, the psychologist that I learned from, Dr. Peter Litchfield, has a great quote that he says, breathing is a habit and respiration is physiologic. Meaning, so respiration would be the actual act of gas exchange at the cellular level in your lungs. So when you're exchanging carbon dioxide and oxygen, that is respiration, but it is not breathing. Breathing is a motion, and like any other motion, you could have a better way to do it and a less good way to do it. Uh, so because it is state context dependent, you could be, if you go back to like Psych 101, state context dependency means that the context of all the everything that's kind of going around you, like you might breathe in a certain way because you're at work, and then you breathe a certain way when you're in your car, you breathe a certain way when you're at home and you're relaxing. And certainly you could attribute to something as simple as stress, but it's not quite as simple as when you're stressed out, you hyperventilate. That could be absolutely the case, but it's more again due to the context of it. Like I've seen people who, for example, a factory worker who had neck pain and headaches, and he had some kind of job where he was working on a like a line, certain tools or pieces would go by, and you would have to quickly assemble them, and you have to keep on assembling things, and he's looking down and basically kind of going from left to right, left to right, left to right for 8 hours a day. So it seemed like it would be, oh, this is going to be, I'm going to just tell him like to do chin tucks and kind of correct his posture and break that up. But none of that really, not only did that actually not have any effect, but um, I figured out that when I looked at him for over breathing, he was only over breathing when I had him picture what he was doing at work. Because when I initially assessed him, he seemed to be breathing fine in lying down on his back, or what we would call supine. Then I had
Mm-hmm.
him kind of sit up and reassessed it. He was mildly overbreathing, but because I kind of remembered and because I learned this initial concept of overbreathing from a psychologist, I tried to think of it from a state context dependency level.
Mm-hmm.
And I said, well, I want you to close your eyes, visualize yourself at work, and actually do the thing that you're doing. Because I had him do it mechanically, and he still wasn't overbreathing. But when he
Mm.
actually visualized it and pictured himself at work, that's when he started overbreathing. So
Interesting.
that psychological component is very, very important. Um, One of Dr. Litchfield's other students, who's a physiotherapist somewhere in Ontario, was working with an Olympic level skater, and the only time she was overbreathing was when she laced up her skates in the locker room, and which is assuming also once you're on your skates, you're doing it on ice. But again, in the clinic, on the table, whatever, walking around, no problem. But the whole state context dependency of course, is an Olympic level athlete, but it doesn't mean that they're not over breathing once they're actually performing.
Right.
So now, right. the getting to the exciting part is the chemical aspect of breathing, and that's why overbreathing is so important because that chemical aspect it means that so overbreathing is is the medical term for hyperventilation. And a lot of people think hyperventilation is breathing too fast, and that might be part of it. But what it really means is the volume of carbon dioxide you are exhaling is too high. And the reason
Mm,
why the level of carbon dioxide is important is because uh, the acid-base balance of your bloodstream is figured out by bicarbonate, which your kidneys produce, and that would be in like the numerator of the equation, and the denominator of the equation is carbon dioxide. And because you can't rapidly change the level of bicarbonate, that might take hours depending on kidney function. You can rapidly change within minutes the amount of carbon dioxide that is left in your bloodstream. So if you overbreathe too much, if you're giving off too much carbon dioxide, then the your bloodstream is supposed to be a certain level of acidity, and I can't remember the exact number. But once it turns basic, hemoglobin, which carries oxygen in the bloodstream, doesn't liberate or let go of oxygen enough. So I mean, that kind of creates this cascade of potentially sensitizing or triggering any complaint
mm,
because oxygen obviously is very important. And the thing is with this, and again, I found this fascinating, is you can have an oxygen saturation rate of 99 or above 99%, which is normal. But if your hemoglobin is not liberating that oxygen, then anything from your brain to a sciatic nerve to a muscle that is not healing to potentially having indigestion, all these things like irritable bowel syndrome or indigestion or um, myofascial pain syndrome or just fatigue or POTS or all these kind of things that are treated medically, but we don't really have a great explanation for.
right.
They have been associated with overbreathing, and overbreathing is it's not a causative factor, but it's something that can contribute to all these things. I call it like filling up the cup. It could fill up the cup of your GI system, or it could fill up the cup of your head and neck tension. So that's why I said I have this like tier of, well, first I'll try all my normal ortho kind of things like manual therapy and repeated end range loading, a la kind of McKenzie. And that works for 80 to 90% of patients, and then I'll start to go into if they're compliant and they're not really responding, then I'll try more of like a integrating pain science approach and doing things like that. But my third kind of tertiary level is, well, I think they're compliant and it doesn't seem like they have some sort of serious issue that needs referral out, then I'll look at overbreathing.
So when you have this patient in front of you and you said you're looking to see if you can replicate this overbreathing scenario, what are you looking for, like clinically? And then the other day we were talking about sort of the symptoms or signs that someone is overbreathing that just the listener can apply to their own situation. So what are those two things that would indicate yes, you're overbreathing?
Well, there's not a lot of like there are tests you can run on yourself, and
Okay.
and listeners feel free to do this because Jono did this and was kind of surprised at the results. But the
Yeah.
first one is actually yeah, it's an exercise, but I use it as an easy objective measure because in and of itself, if you can count to 80, then you can do this test. But it essentially your level of carbon dioxide tolerance is directly related to you overbreathing or not. If you have a low carbon dioxide tolerance, your body will think that more of it needs to be expelled, and it kind of creates this vicious cycle. Then you're exhaling too much carbon dioxide, and you don't ever really develop a tolerance. So a lot of solutions to these things, a lot of these tests are essentially kind of fancy breath hold tests. The first one would be the walking exercise test. Um, so what you're going to do is you just take three normal breaths. Go ahead and stand up while you're listening to this. You can pause it after I tell you how to do it. But you're going to take three normal breaths, and on the third exhale, so it's not a deep breath in, it's not a deep breath out. On the third exhale, you just plug your nose, go for a walk, and count your steps. You walk until you feel like you're going to pass out. Don't worry. I mean, well, hopefully you don't pass out. Most people don't do that. They kind of, they unplug their nose and take a deep breath and maybe get a little dizzy. But count how many steps. You can pause it right now and then we'll come back. But if you're just joining us after you tested that, I alluded to it earlier. You should get 80 steps. And I think Jono got about 26, which is around what I got the first time.
Right, right.
And
Yeah.
yeah, understand that if you are over breathing, though, again, with if normal is supposed to be 80, anywhere around 0 to 20 would be severe overbreathing, and then 20 to 60 would be moderate overbreathing, and then 60 to 80 would be minimal overbreathing. If you kind of divide those into thirds, it has nothing to do with your level of health or fitness. Um, because I've done this on professional athletes who scored, below 20.
Hmm.
So if you are very fit, you can still overbreathe. And there are other signs you can do. You might be able to tell once you're mindful about it to see if you're overbreathing. Those signs would be, do you sigh a lot throughout the day? Do you yawn a lot throughout the day? And a big one, which again, I've tested or if you just even asked very fit people this, can you nasal breathe during even light activities? Most people say like, oh yeah, sure. 100%, I am nasal breathing when I go for a walk. But then they walk out of the clinic and then they go for a walk that day and they realize that shortly after they are going for a light walk that they have difficulty nasal breathing.
Hmm.
And so the other aspect of overbreathing that has a lot to do with it is you should be nasal breathing through the majority of even light activities. And then once you actually develop your carbon dioxide tolerance with a lot of breath hold activities, then um, you can start to do it during moderate to heavy exercise. But nasal breathing is important for a couple of reasons. One, you have villi in your nasal cavity, and that naturally kind of filters out bacteria and viruses. So you're more likely to actually get an infection if you mouth breathe.
Right.
Mouth breathing also kind of changes the structure of your face, and it actually makes if you've been doing that your entire life, then you may actually have more narrow nasal cavities, and that would actually make it more difficult to nasal breathe. So nasal breathing is also extremely important because in your nasal cavity is where nitric oxide is produced, and nitric oxide is a very important molecule for overall health, inflammation, but in general, if you have a good level of nitric oxide in your system, then you have vasodilation, meaning your veins and your arteries expand. So again, if you're overbreathing, if you're giving off too much carbon dioxide, it's this double whammy of potentially mouth breathing too early, you are getting vasoconstriction or shrinking of blood vessels instead of expansion. So you're getting decreased blood flow. And what blood flow you're getting to an area like your head, your neck, your brain, uh, it's actually the hemoglobin is also not releasing enough oxygen. So that's kind of like this double whammy thing. So, to correct these things,
Yeah, because as a physical therapist, we want to know, okay, what are exercises, what are things we can do to improve this? Yeah, how do we change the situation?
for sure. Well, the walking exercise is the first thing you should be doing
Okay.
is you're going to be doing that 10 minutes a day. So, you walk as long as you can. Maybe it's 20 steps, maybe it's 30 steps. It might take you 30, 40 seconds. That is one rep. Then you wait 1 minute and then you go again. So you're not doing 10 minutes of the actual walking. You're doing a 10-minute total of how many reps you can fit in with 1 minute in between. And because carbon dioxide tolerance is a lot like muscle hypertrophy or anything that's like an adaptation, like stretching a truly tight muscle, anything that actually is an adaptation takes a long time. So what you would expect is that if you do these breath holds for 10 minutes once a day, that score will improve by maybe 10 steps or so every 2 weeks or so. Um, and so along with that, you should also do a type of box breathing. Box breathing was kind of popularized to make 4-7-8 breathing easier. 4-7-8 breathing is prescribed by a lot of therapists and psychologists to kind of just help you relax and kind of tune down a wound up nervous system. But the problem is with 4-7-8 breathing, even though I used to teach it, I would still kind of have to look up every once in a while. I don't remember whether it was like inhale for 4, hold for 7, and exhale for 8. And I don't remember where like the parameters are, or like where you hold and where you inhale and where you exhale.
Right, right.
So a Navy SEAL said, yeah, Navy SEAL said, oh, well, I'm going to make this easier and just call it box breathing. You just inhale for 4, hold for 4, exhale for 4 seconds, then hold for 4. So it's a box. Now, when I discovered that, because I have difficulty sleeping when I travel, the article I read said if you try this box breathing, you try 4-7-8, you'll go to sleep right away. But the thing is, because I had moderate to severe overbreathing, I wasn't ready for the breath holds, which increased my carbon dioxide levels higher than what my central nervous system felt comfortable with. So instead of actually getting relaxed, my heart was racing and I was like all wound up and getting super anxious.
Mm,
So I was like, well, this isn't
interesting.
working at all. I'm actually like having way more difficulty sleeping,
Mm,
doing this box breathing. So depending on where you score on that walking exercise test, again, if you're moderate to severe overbreathing, your box might only be 1 to 2 second
right.
inhale, 1 to 2 second hold, 1 to 2 second exhale, 1 to 2 second hold. And some
Yeah.
people say, like, oh, well, that's a lot easier. I have no problem doing that. But the thing is, you have to do that for 5 minutes twice a day. And the first 3 minutes might be fine, but then you really start to get anxious for that minute 3 to 5. Because again, you're just slowly creeping up the levels of carbon dioxide, not to dangerous levels, but you're just kind of pushing it, right? Like every single thing we do, whether it's strength training or, time restricted eating, things like that, those are all things that stress us, stressors end up being good for us because that's like how we adapt and become more resilient. But if you stress too much, then something happens or an injury happens. But you do have to stress the levels of carbon dioxide. You just have to push it and push it and push it until an adaptation occurs and you are more comfortable with having that level kind of remaining when after you exhale.
Yeah, I love this. And anecdotally, the other night, so I did the 10 minutes of, sorry, did you call it the walk test? Is that right?
Walking exercise, yeah.
Walking
Yeah.
exercise. I did the 10 minutes of the walking exercise the other night, and I like pretty much naturally woke up at 5:30 and felt like great. And it was different enough. Like I had energy. It wasn't like I wasn't thinking at all like hit my snooze. It was just like boom, I'm ready. And it was different enough that I thought, wow, like there's something to this. And so I've continued it. I'm hoping because 26, yeah, that was like, man, I need to release this oxygen. I need to
Right. Yeah.
utilize.
Yeah.
Yeah, yeah.
Yeah, if you're like me and you think like, oh man, it should be 80, and you're like, I'm hyper
Right,
competitive with myself,
right,
not necessarily with
yeah,
other people, but if I know I should be hitting a certain target. And the funny thing about overbreathing is that it is considered like a lot of research on overbreathing shows that and a high percentage of the population, maybe 60, 70%, is overbreathing. And
mm,
when I teach this in a whole class full of physical therapists, just last month I got asked by the owner of several clinics, very experienced physical therapist. Well, he's like, well, if we're all failing, then is this is this normal? You know what I mean? And I was
right,
like, well, normal, the mean or the average doesn't mean that it's healthy. It might be
right,
normal, as in everyone kind of fails the test, but it doesn't mean that it is healthy because in terms of health, I just said, should the average person be able to deadlift, like 1.5 times their body weight? Should you easily be able to run a 5K? You should be able to do those things, but can the average person do those things? Right?
right,
Probably not. It doesn't mean
right.
so the average person passing or failing doesn't is not an indication of whether it's healthy or not. So a couple other
Yeah,
things you can do, just try to nasal breathe as much as you can throughout the day during all activities. And it's harder than you think, but if you do that, you'll be more likely to increase your nitric oxide. Also, research shows that if you hum for 10 minutes a day, and it doesn't have to be 10 minutes consecutive. Initial research said it was 10 minutes consecutive, and then further research said you can kind of break it up. So I say hum along to two or three of your favorite songs, but it should be more of a low hum. If you do a high hum, like versus the low hum, like like a om. Think of like a Tibetan monk or something, sitting cross-legged meditating. Maybe they did that because it dramatically increased nitric oxide. Because when you vibrate and you stimulate that nasal cavity, it does dramatically increase nitric oxide. I haven't got anyone to try this yet because everyone else kind of just improves with the other things. But also, it's an easy biohack, they call it, to strap your mouth closed or to use the hostage tape and tape your lips closed, kind of in an X like this. Um, because if you tape your lips closed at night or you use the head strap and you're not mouth breathing at night, then you're nasal breathing all night, then that tends, again, you wake up usually with a bit more energy because you're producing more nitric oxide.
Yeah, that's a good point of clarification. I tell people to breathe through their nose all the time, and oftentimes their mouth will still be open, and they'll I don't know exactly what they're doing then, because if your mouth is open, you're pretty much breathing through your mouth, so your lips need to be sealed, and that's a good test of understanding if you're able to breathe through your nose properly or not. So it's less of just
Yeah.
like, oh, my mouth's open and I need to think about breathing through your nose. You actually physically need to close your lips, so that
You
there's
do
no
need to
option.
you do need to close your lips, and that's the hard part. That's the hard part for most people is
Hmm.
they are so used, they think they're nasal breathing, and they might even be nasal breathing, but you're not fully using the nasal cavity if there isn't another means to kind of change that pressure gradient inside and outside your body, right? Like, because that's giving the air just a different path to
Right.
travel, and you're not
Hmm.
going to be utilizing your full nasal cavity.
Yeah. Right. Okay. And so this is all translated, like you said early or yes or last week, and then early on in the podcast, to leading to some great results in people that were kind of not responding to the traditional methods. Is that correct?
For sure, yeah. And again, has this helped a lot of people with headaches and neck pain? For sure. But they also say sometimes it doesn't help their particular symptoms, but they're still so happy because they're like, I don't need coffee anymore, or I
Right.
have way more energy, or I'm not yawning all day anymore. Uh, and the way first started using this is I would help people, hey, let me try this on this chiropractor who's seeing me for chronic low back pain. It didn't help his low back pain, but it actually helped his long COVID.
Yeah.
So
I love that.
it's not, that's why I say it's not something that could potentially, it's not a diagnosis. It's not something that absolutely causes headaches and neck pain, but it could potentially just sensitize your system enough or fill up your cup enough so that you have less of a buffer zone to kind of do the things that you want to do. Whatever it is that triggers symptoms, they're triggered easier because your cup is more full.
Yeah. I love that. That's kind of that third leg of our system of our system here at Novera, our framework, when we look at really just general health and like systemically, what is the body having to deal with that's adding a stress in a potentially negative way, and makes it less likely to be able to tolerate whether it's like neck tension or this pain signal that the brain's receiving. So I think this is fantastic, but it seems like it has a direct impact on maybe relieving some of that mechanical stress and strain when you talk about breathing. And so I think there's a ton of benefits here, and this is very, very practical for people to just one test and then start doing, which I love.
Yeah, for sure. Yeah, I mean, even mechanically, if you start more diaphragmatic breathing, that's like the diaphragm is a great core muscle that no one ever works out, and if you diaphragmatically breathe properly, it ends up like facilitating or kind of activating your pelvic floor, which stabilizes your lumbar-pelvic area. And again, if you're really expanding your lower ribs and not sternal breathing as much, then you get a lot of more thoracic or mid-back movement, and that can help with shoulder tension and neck motion. So there's a lot of things that could be, it's free, it's easy, it's an easy health hack to try. But yeah, basically, if you need like a breathing program, a breathwork program, I basically take patients over the course of like 6 to 8 weeks, maybe meeting once a week or once every other week. And it could potentially help with anything from headaches to just other health issues that maybe you didn't even realize were being sensitized by breathing.
That's awesome. Tell everyone once again, like how do they reach out to you? How do they find you?
Sure, you can just go to my clinic webpage, which is
Okay.
edgerehabandsport.com. And or if you just even Google Dr. E or modern manual therapy, I'm very Googleable.
Okay.
My name's not very easy to spell, but yeah, if you just look at up Erson Religioso or Edriab in Sport, there's many different ways to get a hold of me. I'm also at Modern Manual Therapy on Facebook, Instagram, and YouTube. You can reach out to me any of these ways. I don't have staff, so if you get a reply, it's from me.
That's awesome. I love that. Well, thank you, Dr. E, for being on the Headache Doctor podcast. This was incredibly helpful. I think it'll be one of our top podcasts, and hopefully people listening to this have not only applied this to their situation and are eager to go test it, but potentially even reaching out to you so that we can continue this journey of helping people with headaches and migraines. So thanks for being on the podcast.
Thanks so much for having me on.
All right, everyone. So we appreciate you, the listeners. You guys are fantastic, and you have, taken up that call to action of writing a review, whether that's Spotify, Apple Podcasts, wherever, and it helps the algorithm. It pushes us forward as we're on this mission to educate and empower everyone with headaches and migraines so that we can break free from a life of fear of your next headache or migraine and dependence on medication. We'll see you next week.